Hello everyone, welcome back to Medical Coding Club. This is Chandrika. So today we will see one important concept from musculoskeletal system, which is arthroscopy procedure. Arthroscopy procedure is very important, so we will understand the procedure overview and also the coding guideline associated with arthroscopy procedure, and we will see few practice questions to understand that arthroscopy procedure. Okay, and please do watch video till end, and if you find it useful, please do subscribe to my channel and please do support. And if you want to join my complete CPC course, or if you only need any CPT classes or ICD classes, or you need only mock preparation, then you can reach me on this given WhatsApp number. Okay, so let's begin with the session. So firstly, we will understand arthroscopy procedure overview. So what is arthroscopy? Arthroscopy is a minimally invasive surgical procedure used to diagnose and treat the joint problem. And it involves inserting a small camera, which is arthroscope, through a tiny incision to visualize inside of joint. Okay, so whenever we talk about the scopies, it could be endoscopy or arthroscopy, we will utilize the scopy to visualize the internal organ or a structure. Same way, we will use arthroscopy to visualize inside the joint. Okay, so next, one coding guideline is there, important coding guideline. So you can take, as I said, it could be surgical endoscopy or arthroscopy. It always includes diagnostic endoscopy. Okay, so when provider is performing diagnostic arthroscopy and surgical arthroscopy, then you don't have to code for diagnostic, because diagnostic arthroscopy is included in surgical endoscopy or arthroscopy. Okay, the difference between diagnostic and surgical is diagnostic is for screening, surgical is actual procedure. Once they understood what is the abnormality, they are going to treat. Okay, while treating, that will be considered as surgical arthroscopy. Okay, so first they are visualizing, they are understanding the abnormality, then they are immediately performing the surgical arthroscopy procedure. Then you just have to code surgical arthroscopy. You don't have to think about your diagnostic, because it is an integral part of the procedure. Okay, this guideline is important. Next, when arthroscopy is performed along with the orthotomy, okay, orthotomy means open joint procedure, we have to use modifier 51. Okay, since both are multiple procedure being performed at the same session, you can use 51 modifier. Okay, when they perform both arthroscopy and orthotomy procedure. Next is loose bodies or a foreign body removal. Okay, so you may report arthroscopic removal of loose bodies or foreign bodies only when the size of the loose bodies or foreign body is equal or larger than the diameter of arthroscopic cannula used. Okay, it should be the size of the foreign body or the loose body, it should be larger than the diameter. In size, it should be larger than our arthroscopic cannula being used for the procedure. That is one very important coding guideline. Next, as I said, they'll use the larger cannula and then the one used for the main procedure, or the separate incision or enlarged portal specially made for removal. So either if they are utilizing the same larger cannula, the abnormality or the foreign body should be bigger in its size, okay, than arthroscopic cannula. If not, they can do a separate incision and they can do a separate procedure for removal. Okay, so these are the coding guidelines comes under arthroscopy procedure. So this arthroscopy guideline you can check from here. Okay, so you can check whatever I have explained, it's in this paragraph. So next, now we will understand a few procedures, okay, few procedure and how they will like they'll perform, and also each procedure is very unique. Okay, in exam, any one procedure under arthroscopy definitely you will get. Okay, either they can question about meniscectomy, or yeah, they can question about rotator cuff repair or femoroplasty, okay, or TFCC. Any one procedure is must and should. So for that, we have to go through all of these procedure, and we will understand on which location they'll perform and what are the specific coding guidelines we have for that particular procedure. Okay, so first is meniscectomy. So this is typically performed on knee region, and code being 29881 series. Okay, from that the code will start. So surgical removal of damaged portion of meniscus. So they will perform ectomy, that means removal. Okay, what they are going to remove? They are going to remove the damaged portion of meniscus in the knee joint. Okay, so you should also know the meniscus is a C-shaped cartilage in the knee that acts as a shock absorber between femur and tibia. Okay, you can see here the image. It is C-shaped cartilage. And here in the meniscus, we do have type, okay, medial meniscus and lateral meniscus. So this is very important. We need to identify from which area they are going to remove the meniscus. Okay, is it medial or a lateral? So this key point is very important because we do have a separate code for that. So medial meniscus means it's an inner knee cartilage, and lateral meniscus is outer knee cartilage. And in this, meniscectomy, we will be having the procedure orientation also. Partial meniscectomy and total meniscectomy. Partial is, it removes only, in the partial, it removes only the abnormal or the torn or the damaged portion of meniscus. Coming to total, it removes entire meniscus. Okay, and it is less common due to long-term joint implantation performed arthroscopically in most of the cases. Okay, so usually in CPC exam, you will be getting question regarding partial. Partial, as I said, they are going to remove only a torn or damaged portion of meniscus. Okay, so typically, as I said, it is performed on knee. So next we will see other procedure as well. So rotator cuff repair, okay, on shoulder. So repair of torn rotator cuff tendon in the shoulder. So this is the procedure they are going to do under rotator cuff repair. Next we have one more important procedure, that is femoroplasty. So femoroplasty is reshaping the femoral head or a neck junction to remove a bony bump. Okay, example, cam lesion. So cam lesion is nothing but it's an abnormal bony growth at the head or neck junction. Okay, in order to remove this lesion, they may perform femoroplasty procedure. Okay, that is femoroplasty is like it is also a surgical procedure where they will reshape the femoral head or a neck junction. Next, last procedure is triangular fibrocartilage complex repair. So it is a repair for tear in the TFCC, a cartilage structure in the wrist. So this procedure is also important. It is for wrist, and femoroplasty is hip, rotator cuff repair is shoulder. Next, one more terminology we need to understand. It is chondroplasty. Okay, chondroplasty. The meaning of chondroplasty is they can perform debridement or shaving of articular cartilage. And this chondroplasty is not separately billable when done with these codes. So if they are saying femoroplasty along with chondroplasty, then chondroplasty is already, it is included. Same way with the meniscectomy, chondroplasty is included. So I'll show you the codes, then you will understand. See here, meniscectomy. In this, if you see, including debridement, shaving of articular cartilage, that is chondroplasty. It is included in meniscectomy procedure, so that we don't have to code that chondroplasty separately. Okay, this guideline you should know. So next, so by seeing these info, okay, you got to know what is arthroscopy and the guideline associated with arthroscopy and few definitive procedures. Okay, the meaning, everything you have understood. Now we will quickly see the question. So the first question is regarding 62-year-old female patient was referred to Dr. Stegman for increased right groin pain. Okay, condition is increased right groin pain, and the patient described the pain is worse with sitting and risking the seating position. The pain was temporarily relieved with the intra-articular corticosteroid injections. Under Dr. Stegman's physical examination on Monday, documented loss of internal rotation, loss of hip internal rotation, and then they suspected there is a cam lesion, like they are suspecting the cam lesion, and referral for x-ray with orthography followed by ct with contrast. Both x-ray and ct scan verified a cam lesion. Okay, both x-ray and ct scan, the result came as patient is having cam lesion. So next, today, 1 week later of the initial consultation. So here you should be very careful. Okay. So you have to read the question once again. So you will understand. So this is up to here. This is an initial consultation. Okay. From now, today, that is 1 week later of the initial consultation, Dr. Stegman completed a surgical right hip arthroscopy, including femoroplasty, to repair the cam lesion. How should Dr. Stegman report today's service? Today's service, okay, the question is being asked about today's service, and students may go wrong by assuming, say for example, here they have performed orthography followed by ct contrast. Okay, but when they performed in the initial consultation. In today's visit, they did not perform. Last consultation, they scheduled, okay, they confirmed there is a cam lesion. And in today, they are doing a procedure for cam lesion, that is femoroplasty, hip surgical right hip arthroscopy, including femoroplasty, repair of the cam lesion. Okay, this is our current procedure. You have to code only for this. Okay, do not go back and code for orthography and CT. That will be wrong codes. Okay, so by understanding that, you can eliminate this radiology service codes easily. We don't need this radiology codes since we are billing for today's service. Okay, directly AB is deleted. And next, if you check option C and option D, so first you can refer 29914. Okay, 29914 is the see 29914 is here, it is resequenced. Okay, so see 29861 arthroscopy hip surgical with removal of loose body or foreign body with debridement. Next, with synovectomy, with femoroplasty, that is treatment of cam lesion. Okay, arthroscopy hip surgical with femoroplasty, and they are using femoroplasty procedure to treat the cam lesion. Okay, it directly you got the answer. 29914 is the correct answer. Okay, 29914 is correct answer. So that option C is correct. Okay, so you can refer all the options, take your time and read the question go and refer all of the options, and you can, eliminate options, and you can also conclude your answer. So here, correct answer is option C. Okay, I'm not going to all the options and verifying. I'm just explaining the question and directly giving you the rationale. So answer C is correct. Okay, since I have showed the description of the code, it is rightly suggesting that they performed surgical right hip arthroscopy, including femoroplasty, for the treatment of CAM lesion. Okay, so why we are using RT? RT we are using because it is right hip, right side, so that they are using RT model.